According to the American Nurses Association, a registered nurse holds the responsibility to maintain professional competence. This includes being educated in an area of nursing that they practice within and abiding by the standards for skills and duties necessary for patient care. The employer is responsible and accountable for providing an environment conducive to competent practice. In regards to patient care, identifying and maintaining appropriate number of nursing staff is critical to the delivery of quality patient care. The gap in which healthcare employers fail to recognize the association between RN staffing, like myself, and patient outcomes are what I would like to talk to you about today. A registered nurse is a patient's primary advocate. This is very crucial to the patient's care. So the nurse is the primary advocate for the patient. Along with being that primary patient advocate, the nursing profession plays a huge role in patient safety. We are expected to prevent medication errors, ensure patients receive the correct therapy, and provide safeguards for problems such as falls or skin breakdowns, according to Crone. Nurses today, compared to 10 years ago, are typically better educated with a focus on coordinating patient care and the use of critical thinking skills. Despite how qualified the nurse may be to care for his or her patients, if the ratio is not proportionate to the acuity of the patients, then patient outcomes can be significantly impacted, usually in a negative way. Nurse-to-patient ratios can vary from state to state. In Pennsylvania, our nurse-to-patient ratios that are proposed for the area that I have experience in is where I'd like to focus on. Nurse-to-patient ratios in Pennsylvania, in a critical care setting where I work, the nurse-to-patient ratio is typically 1 nurse for every 2 patients. So these are the recommended guidance lines by the Pennsylvania Association of Staff Nurses and Allied Professionals. So those are the recommendations that the government has put out there. These requirements are listed as part of the minimum staffing requirements of the Pennsylvania Patient Protection Act. So these are listed in order to ensure the protection of the patient and ensure this quality care that we all strive to give to our patients. The current legislation of Bill number 438 states that the nurse-to-patient ratio for critical care should be 1:2, just as the Patient Protection Act recommends. Sadly, despite these recommendations, employers do not always choose to abide with this legislature that has been put in place to protect the rights of nurses and the care of patients in the hospital setting. That's very important. These have been put in place for a reason, to protect not only the nurse, but the patient care. The care of patients like yourself or your loved ones is severely compromised when nursing staff is faced with more than 2 high acuity patients in that critical care setting. Individualized patient care is no longer the priority, and the nurse is then obligated to focus his or her care around tasks, rather than he or she's assessment skills and knowledge base. According to a study funded by the Agency for Healthcare Research and Quality, there is significant association between patient mortality and exposure to nursing shifts that fall below target staffing levels or have that high patient turnover rate. In this study, staffing levels that were found to be below the target rate occurred in 15.9% of all shifts. This was most likely to occur in the critical care setting, where 19% of shifts were below that target range. This was most likely in the critical care setting. The critical care setting is the area in which I work, which is considered emergency room, critical coronary units, and the ICU, which is an intensive care unit. So what does this all mean to you? To break it down in comprehensible information for the typical patient, there is a 2% increase of mortality rates for every shift a nurse works that is not staffed according to the standards set by legislation. As a registered nurse, this is 2% too many. It is our duty as the most trusted profession to care for our patients safely and represent the nursing profession by abiding to those standards of that role. Patient care should be the employer's priority because it is my personal highest priority. I strive to deliver the best patient care, and despite these unproportionate ratios that we are faced with, most nurses have the top priority of quality patient care. Although you may not be a registered nurse like myself, I urge you to take part in the campaign to ensure that these ratios are met, because we all deserve the best care possible for our loved ones as well as ourselves. Join our efforts to ensure that patients receive the care that they deserve. According to SNAP, proper staffing can save lives, reduce errors, decrease complications, as well as improving that patient satisfaction, all while still reducing nurse fatigue and burnout. I hope that you will consider the information I have shared with you and utilize it to help make a positive impact in patient care. And I thank you.